All right, it looks like we are now live on Facebook. Woohoo! Hello, everyone. I am Rebecca Cerise. I am a proud member of the North Carolina Medicare for All Coalition. As you can imagine, fighting for Medicare for All across the entire state of North Carolina. Welcome, welcome, welcome to our Feet to the Fire Facebook Live event. We are super excited to have you here. We're all getting very excited about the election finally being here, the importance of voting, the importance, especially in this year, healthcare really is on the line this year, and everyone needs to get out to vote. Find out where your people stand on the vote on healthcare and vote accordingly, please. We are in the middle of a pandemic. I don't need to tell anyone that, but our healthcare system was in crisis before COVID-19, but now that we are in this public health crisis, it has gone up to 11. And it's so obvious that we need a universal system that has no cost barriers to care. And what that policy is a Medicare for All policy, a single payer universal system. That's the only policy that can provably be a universal program and control costs. And that's what we're looking for, with no cost barriers to care, which is an essential piece because so many people can't afford to go to the doctor, even when they are insured. That's called underinsurance. And, you know, we've heard a lot of politicians through this election cycle talk about healthcare as a human right, healthcare is a human right, but yet they don't then turn around and support the one policy that actually would make healthcare a human right, which once again is what we're calling Improved Medicare for All. And so our job is to vote. First step is voting, but that's only the first step. And after that, we need to really hold their feet to the fire and push, push, push for the policy that we know is the correct policy that can actually cover all our people during this time. So we're really excited to have you here. We have undertaken as a coalition, well, first of all, we have about 30 actually over 30 organizations in our coalition across the state, and we are all over the state. Very exciting, lots of different types of community groups, religious groups, unions, healthcare provider groups, just very regular community groups. So we're excited to all be pushing forward together, because only together are we going to be able to do this. So please check out our website, which is www.NCM4A.org. And we'll put it in the comments in the Facebook as well. I want to tell you a little bit about our first campaign. So our first campaign, we wrote a petition or a letter that we sent out that we addressed to all of our congressional incumbents, people that are running to challenge them. And it was to ask them to support the Healthcare Emergency Guarantee Act, which was put forward in the House by Representative Jayapal and in the Senate by Senator Bernie Sanders. And what that would do would be expand the powers of Medicare to cover everybody who's uninsured during this pandemic, and also to cover all out-of-pocket costs for people who are insured, again, to take that cost barrier out of the way. This has not gotten a lot of attention because it's not a giveaway to giant insurance companies, but we felt it was very, very important to really push this. So we put a petition up on our website. It got a lot of signatures, so thank you if you signed it. And we then have, during this election cycle, have gone and delivered these, even during COVID, and we did it safely. We delivered these letters to our different congressional representatives, our senators, and also some people that are running for office. So want to now play a video that shows us delivering them, so you could sort of see what that looked like, and also to hear from some of the people that are in our coalition about why this is such an important issue for them. So give me a second to share my screen. Thanks for your patience. Okay. Does everyone here see my screen? Okay. We are here at Tom Tillis's office in Raleigh to deliver our letters that are asking for Tillis to support the Healthcare Emergency Guarantee Act.
And we've collected signatures from more than 24 North Carolina organizations and more than 1,000 voters.
One of the biggest problems we're facing with this pandemic, but also before, is people who are underinsured, who can't afford to go to the doctor despite having insurance. This Healthcare Emergency Guarantee Act will get rid of all cost barriers to care.
This election year, we have also seen that many people support Medicare for All system. Unfortunately, our two major candidates are not supporters of a Medicare for All system. But I do believe that a strong grassroots movement can help whoever wins the next election realize that a better America starts with all of the residents of America having a good, comprehensive Medicare for All system.
A registered nurse. I work in hospice home care, part of the Mission Health System in Asheville. In order to take care of our community, we need to do better. The only way that we're going to do better is to have a Medicare for All situation. Taken the shareholders out of this, taken that the money out of that hospital and putting it toward the better good of our patients.
Medicare for All is the only true single-payer universal healthcare system that enables everyone to access healthcare that they need, and if enacted, could have a profound effect on reducing healthcare disparities. It's estimated that over 1/3 of the disparities would be eliminated if Medicare for All was enacted.
In this world, some of our elders are choosing right now between purchasing groceries or purchasing their monthly meds. I have a family member who has gone on to be with their creator because they stopped taking their blood pressure medicine. I don't know exactly why, but I am pretty sure that money played a part in that decision. There were 3 small children in the household, so I know that that laid on her heavily as well, having to choose to provide for her family or having to buy prescriptions that were a necessity to her life.
I worry about being kicked off of my parents' insurance 4 months from now and not being able to afford doctor's visits, preventative procedures, monthly medical supplies, or even the infusion therapy keeping me in remission. When you're fighting for your future, paying medical bills should not be part of the stress. We cannot wait. Support Medicare for All. Make sure you're registered to vote.
It is important for each of us to ensure that we are putting individuals that are change agents in office, not just going into a voter's booth and choosing who we've seen most on a sign or who we've seen most on a television screen. We have to be responsible for choosing the accurate people to put in office so that everyone will have access to care. There should never be a time where we live in the most developed country in the world and we have the worst birth outcomes than a third world country.
Let's stand together and respond effectively to this pandemic crisis by advocating for an equitable, efficient, and fiscally responsible healthcare system that prioritizes public health and protects the well-being of the American people during this pandemic and beyond.
All right, stop share my screen, and now I'm going to turn it over to one of our superstar. Oh. One of our superstars, Megan Dunn.
Hi everyone, I'm Megan Dunn. I'm a registered nurse and I live in North Carolina's 9th district. And I am fighting with the Coalition and Healthcare Justice North Carolina for Medicare for All because 2 years ago, this summer, my mom was diagnosed with a recurrence of the breast cancer that she had when I was a little girl. And after this recurrence of her cancer, for months, nearly every surface in my parents' kitchen, dining room, living room was completely covered in stacks of medical bills and financial documents. And my parents underwent a lot of emotional stress and financial stress with the cost of her health care. My mom's health insurance was tied to her employment and she was still a few years away from qualifying for Medicare. She was on disability for a while, but now she's unemployed because she's unable to work. She pays a high monthly premium, about $900 a month for COBRA coverage. And she worries about how she'll pay for the care she needs in these financially uncertain times, especially with the pandemic. I come from an educated and an employed family, and what happened to my mom can happen to anyone. And our healthcare system shouldn't be so difficult to navigate, and it shouldn't place such an emotional and financial burden on people. Medicare for All is the only solution that's going to eliminate these injustices and ensure that all people have access to health care that they need regardless of their employment status or their ability to pay. Also, as a nurse in an outpatient pediatric office, I spend a lot of my time fighting to help my patients get the insurance coverage for their medications, their medical equipment and supplies, and the therapies that they need. I see how difficult it is for parents to get their children the care they need and our fragmented and difficult to navigate healthcare system. And many families are struggling because they're either uninsured or underinsured. The COVID-19 pandemic has caused a tremendous increase in unemployment and a loss of health insurance coverage. And so again, Medicare for All is the only solution that's going to ensure that all people have access to health care regardless of employment. I'm a resident of North Carolina's 9th district, and with National Nurses United, I hosted a legislative meeting with Dan Bishop, or with his legislative director, to talk about Medicare for All. And then I also met with Cynthia Wallace with 9 other members of Healthcare Justice North Carolina. Cynthia Wallace is running for the congressional seat against Dan Bishop. And I have yet to hear back from Dan Bishop's legislative director of what Bishop thought of our presentation and the need for Medicare for All. Cynthia Wallace supports strengthening the Affordable Act, but I know that she is open to learning more about Medicare for All. I want to speak now directly to Cynthia Wallace and other people running for office, to Cal Cunningham as a constituent. Medicare for All now. We've needed it for a long time. It's the next step forward. It's going to eliminate out-of-cost payments and cover costs for dental work, hearing, vision, and prescription drugs. It's going to protect everybody, and we'll have complete freedom to choose our doctors and hospitals. We're already paying for it. Medicare for All will be paid for through taxes, but those taxes are going to be less than what we pay now for healthcare for at least 95% of people. I'm going to pass it now to Dr. Rohima Mia.
Hi, all. My name is Dr. Rahima Mia. I'm a psychiatrist in Wake County, and I want to talk to you a little bit about what it was like for mental health patients prior to the pandemic. Unfortunately, prior to this pandemic, we already had an epidemic of mental health issues. Thousands of lives in this country are lost to suicide. Thousands of lives are lost every year to alcohol and drug abuse problems in this country. Thousands of work hours are lost to people being depressed, or jobs lost due to depression and other mental health issues. and number of students, which is a time when many people get mental health issues when they're in high school and college, end up being able to have to interrupt their school careers and their job career due to mental health issues. This has only been exacerbated by the pandemic. Unfortunately, these kinds of issues are often issues of despair when people do not have access to their families and friends, and people become more lonely and more depressed. It is exacerbated during the pandemic, and even more exacerbated when people have to worry about, how am I going to pay for it? How am I going to pay for it when it's tied to my job? And I will tell you that in mental health, even though there was a parity law passed over 10 years ago to say that patients should get the same health care for their mental health issues as for their physical health issues, which is still not happening, that has never been true. Our organizations in the mental health field have often had to even file lawsuits against some of these private insurance payer that refused to follow the law that was passed years ago in order for patients to have access to care. And this has only gotten worse during this pandemic. Every week I see patients who have been doing actually very well prior to the pandemic, but due to the fact that they can't see family and friends, the fact that maybe they're stuck working at home or have lost jobs, their depression level has gone up, their substance abuse has gone up. This is how they're coping. Only bills such as the Medicare for All bill can eliminate these problems, and people don't have to worry about at least that one aspect of their life. I want to spend a couple of minutes talking about how it's impacted, in particular, the Black community and other communities of color. This pandemic has shown how decades and decades of inequality has impacted communities of color. Unfortunately, for years of inequality, many Black people, many people in indigenous communities, many people in the Latinx community already suffer at a higher rate from many mental health issues and primary health care issues such as diabetes and obesity that make them at higher risk for getting COVID. And they're dying at a higher rate due to these already existing inequalities. A Medicare for All system would eliminate that, because patients would have access to care to their doctors, to the doctors of their choice. And just like Megan talked about in her clinic, I spend a lot of time talking to patients about how I have to fight with their insurance companies to get the medications, get the treatment they're entitled to. And some patients with severe mental illness are not eligible for the most important things that we can provide for them, like some community care, because private care will not pay for it. They will not allow for people to go to different places because they have to have certain kind of insurance or have no insurance at all, which is ironic when some of the most severe mental illness happens when people are young, but then they have no access to it. And that's the irony of the Affordable Care Act. Many young people were able to stay on their parents' insurance, but that actually eliminated them being able to get access to certain kind of care because they didn't go on Medicaid because they were poor or had no insurance. And so they were not able to get certain kind of care, especially for people with severe mental illness. Everyone uses healthcare from the time they're born to the time that they die. This is something that has to be considered a human right because we all use it. There is not one single person on this planet that will not access healthcare at some point in their life, even if they're not ill. Pregnant women are not ill, but they need to access healthcare. Children are often not ill, but they still need to get their immunizations. They still need to be seen. So the fallacy of our system is that it pretends as if there are certain people that will never use healthcare. So as a mental health provider, as a psychiatrist, we need to recognize that even something like a pandemic that people often see as mainly a physical health problem adversely affects people's mental health and our ability to function as full, equal human beings in our society. So that is why I'm a supporter for expanded and improved Medicare for all, where people can have it public, go to the doctors of their choice, where it's publicly funded. And we certainly must pass this Healthcare Emergency Guaranteed Act in the middle of a pandemic in order for people to access care. I'm going to turn it over now to Dr. Jessica Sachs.
You're muted, Dr. Sachs.
Sorry. Just. I'm Jessica Shore Sachs. I'm a family physician and I practiced for 34 years with the underserved in Charlotte. I chair Healthcare Justice North Carolina. I am here because every single day in my practice, I saw patients who didn't get some kind of healthcare they needed because they couldn't afford it. Sometimes they had dramatic stories. I remember a man who woke up in a pool of blood bleeding from his rectum, and he didn't go to the hospital because he was afraid of the cost. Instead, he waited for an office appointment. He could have died. Other stories weren't as immediately life-threatening, but they were also serious. Some of my patients missed appointments because they didn't have their copays, amounts that might seem trivial to you, but to them made the difference as to whether they could pay the rent or not. Sometimes they didn't have their money for their medications. Some waited to fill antibiotics, leaving their infections untreated. And patients on chronic medications for diabetes or high blood pressure would delay filling them because they lacked the funds, or they would stretch their medications by taking them only every couple of days, even though the medicines don't really work like that. Now, needless to say, many of those patients didn't have good control of their underlying conditions. At the time, this contributed to heart disease and strokes and kidney disease. Well, now we know that those underlying conditions contribute to serious illness and death from COVID-19. Lack of affordability of care worsens outcomes in the short term and also in the long term from COVID. Some of my patients had some insurance, but they still didn't get everything they needed because they couldn't afford copays or deductibles. Some of my patients had no insurance at all. Many of them were on sliding scale, which was supposed to help, but they still missed needed care because they couldn't afford the copays for their visits, again, even though they were very small. And even after the Affordable Care Act was enacted, many of my patients didn't benefit because they weren't eligible for subsidies and they couldn't afford premiums. We need everyone in this country to have comprehensive, accessible health care. We need improved Medicare for all. Until we get there, Americans would benefit from the Healthcare Emergency Guarantee Act, which would be a short-term solution to guaranteeing needed care for all. And I'm happy to say that you saw in the video that we delivered a petition to that effect to Representative Adams' office last week. Now, speaking to Representative Adams, my Congresswoman, and Senator-to-be Cunningham, we need improved Medicare for all and no substitutes. Medicare for all is the only health plan that will cover everyone, save money for individuals and for the country, and offer choice. We need to expand Medicaid, but that won't fix it because it won't cover everyone. The look-alike plans for Medicare for all, such as the public option, just add one more layer of complexity to our already complex healthcare system. And that means they not only won't save money, but they will make the bureaucratic headaches worse for patients and providers. I urge you to do the right thing and support Medicare for all for the sake of your constituents and for the country. And now you will hear from Italo Medelius.
Hello, everybody. Yes, my name is Italo Medelius. I am not a healthcare provider, but I immigrated to this country from Peru when I was 10 years old. And I'd like to speak a little bit about the Hispanic, Latino, Latina, Latinx community and how Medicare for All fits in with this conversation that we're having about the growing demographic of the Hispanic, Latino community. Before I go into that, I would like to just deliver a quick message in Spanish, and then I'll go ahead and translate it over into English. Bienvenidos a todos, gracias por estar aquí. Espero que estén pasando esta pandemia en una manera que por lo menos sea considerable. Hoy día vamos a hablar sobre el programa de Medicare para todos. Durante la primaria democrática, este programa fue introducido para cubrir a todas las personas que viven en Estados Unidos con un tipo de salud. O sea, no tienes que pagar cuando vayas al hospital, cuando vayas a la clínica, cuando vayas al doctor. No se tiene que pagar. Y cuando alguien habla de algo gratuito, cuando alguien habla de algo que no se va a pagar, mucha gente empieza a decir, este programa no se puede tener, se va a tener que pagar demasiado dinero en forma nacional, pero eso no es verdad. La verdad es que el programa de Medicare para todos bajaría el gasto y todos los gastos que tenemos en nuestro gobierno nacional con Obamacare. Especialmente si vamos a expandir Obamacare para tener la opción pública, para expandir Medicare y Medicaid, tendrían más grupos de gente que ese programa cubriría, pero igual no se podría pagar, sería demasiado costoso y también no cubriría a todos. Hoy el grupo de gente que es el más pobre de Estados Unidos son los niños. Ni los niños están cubiertos por algún tipo de salud universal. Lo que necesitamos es salud universal, no salud que sea de bajo costo, no salud para algunas personas, pero salud universal para todos. Soy el vicepresidente del Comité Hispano-Latino del alcalde de Durham. Y durante la pandemia de COVID-19 hemos hablado con muchas personas de la comunidad hispano-latina. Hemos estado organizando con trabajadores de la comunidad hispano-latina en Carolina del Norte. Y el problema de salud y acceso a la salud es impresionante. Gente que se está muriendo en sus camas porque no pueden ir, porque no pueden pagar. Gente que ha perdido su trabajo, que no puede ir al hospital. Uno, por miedo de oficiales de inmigración, pero dos, porque no se puede pagar. Medicare for All, Medicare para todos, es algo que está apoyado por la mayoría de la comunidad latina. Y creo que la comunidad latina va a poder ayudar a nosotros poder implementar Medicare for All. Así que, por favor, si eres una persona que está interesada en hablar más sobre Medicare for All, por favor, vayan a www.ncm4a.org y únete con nosotros. So I'll just translate quickly what I said in that in that speech. So I was just saying that Latinos, Latinx folks in the United States are the fastest growing demographic in the country. So we have a lot of folks that immigrated from this country, like myself, and a lot of people that had kids here. So that population is really growing and expanding. And as a fun fact, actually, statistically, the Latino community, the most LGBTQ demographic in the country. So that's a very interesting thing. And it also plays into the need for universal healthcare, the need to end the HIV epidemic, the need to provide comprehensive care to everybody. Now, if we look at the polling, the majority of Latino, Latina, Latinx folks support Medicare for all. I believe it wasn't in the latest poll that came out, that was a Harris X poll back in June, showed that only 30% of Latinos opposed Medicare for all. The rest were like, yeah, okay, let's do it, or strongly supported it. So a vast majority of people in the Hispanic and Latino community that support Medicare for all. And that's reflected all over. I mean, you can see that the number one priority for people that are Hispanic or Latino, Latina, Latinx is healthcare. And this is a very, very reasonable thing to see in our daily lives. So I'm currently the vice chair of the Durham Mayor's Hispanic Latino Committee, and I chaired the COVID-19 response task force for them during this year. It was a very tough time. As a lot of people know, the Hispanic, the Latino community was hit horribly by the COVID-19 pandemic. And there are very, very systemic issues that led to that. Number one, that the Hispanic Latino community are essential workers alongside with the Black community by disproportionate numbers. So people have to go to work. If you don't go to work, you don't eat. And a lot of people that we saw in North Carolina that were, their kids weren't working, so they took their kids out to work. And because you were able to make more money, and that's the issue, the issue that we're looking at right now. Working class people need healthcare. I've seen very, very heartbreaking stories of people literally dying in their beds because of COVID-19, because they couldn't go to the hospital, or they went to the hospital too late because you couldn't pay for the treatment. Or another reason was also that there were issues with people thinking that there might be immigration authorities at the hospital. So as you can see with a lot of the different polling and a lot of just the life experience by just speaking to the Hispanic and the Latino people, we have a lot of people that are uninsured, a lot of people that are underinsured, and a lot of people that don't even consider it an option to go get care. So if we can remove that one barrier, which is cost, which is probably the biggest barrier, we can have so much more of a more equitable and healthier society. And I think one last thing, I think it's also important to think about the morality of this. How moral is it that we have, these health insurance CEOs making millions of dollars a year, but then we have working class people that are dying in their beds because they can't go to the hospital? I don't think anybody agrees with that. And I think, once again, reflected in the polling, the majority of people support Medicare for all. Why? Because we know that we need to stand in solidarity with our country folks. And specifically, I think in the Hispanic Latino community, we have one of the youngest demographics too, which is also why the support for Medicare for all is a little bit skewed, because we have about 60 million Latinos living in this country, and 60% of those 60 million are under the age of 33. So people that are not consuming news from TV, and people who want a change in this country, and people who also communicate that, like myself, Gen Z, and millennials, that communicate those thoughts to our parents. I turn to Republican parents and to Medicare for all supporters, which I think is a very important thing. And it's something that we need to keep pushing. Specifically in North Carolina, we're going to be a very, very, very important demographic in swinging elections. So very, very quickly, to hopefully Senator Cal Cunningham and Representative David Price, I hope that you're able to see the pain and the suffering that the people within your districts and the people that you represent are going through right now for not being able to access care. And unfortunately, as many of our dear friends on this call have said, expanding the ACA is not enough. It's not going to work. We need to cover everybody universally, because healthcare needs to be something that, as an American, you don't have to worry about dying because you can't pay for your healthcare. Your healthcare is something that's sacred. Your body is something that's sacred, and it's the future. And Medicare for all is going to be coming. It's going to be in the United States, whether we like it or not. So I hope, hopefully, Senator Cunningham and Representative Price, that you're on the right side of history and push for Medicare for all. Thank you all. And I'm not sure who's next. Who am I introducing next?
It's that's me. I'll
Stacey
introduce
Barillo,
myself.
the great Stacey Barillo.
Stacey Barillo, thank you so much. That was such a great case, Italo. I was wondering, could we just get you to talk for one more minute? Because I know you met with Rep. Price's staff and Cal Cunningham's staff at some point in the last couple months. Could you just kind of give us a quick recap to those listening about what those meetings were like and kind of what the response was from that?
Of course, definitely. So we met with Representative Cal Cunningham probably about a month ago. Rebecca was there, and Rebecca organized it actually. She was the leader of that. So we had a few folks there, and we spoke with some of his staff members. And we made our case for Medicare for All. A lot of the same things that I said about the Hispanic Latino community today. We had a representative speaking for Black Voices for Medicare for All, and we had a lot of different folks that were speaking. We didn't really get too much of, I guess, a response to that. They were very adamant that Cal Cunningham is on the expanding the ACA side of things. And it seemed like right now he was a little bit immovable. But as an elected official, you're never immovable. You either move with the public opinion and what people need, or you get voted out. So we're going to keep pushing on that, and hopefully, those of us that voted for Cal Cunningham will be able to speak to him and to his office to make sure that we're pushing for Medicare for All as an essential law that needs to be passed. Then very quickly for Representative Price, we did speak with his office. They were they were a little bit more open to Medicare for All. They are co-sponsors of Medicare for All. Something that we were talking to them in that meeting was that we don't just need a co-sponsor, we need a champion. We need somebody that's going to put pressure. We need somebody that's going to be in Congress and be a leader in North Carolina. And hopefully, as the Medicare for All coalition grows, we're going to be able to have our entire North Carolina congressional delegation backing Medicare for All. I'm very, very, very confident in that. And also, we asked for them to back the Healthcare Emergency Guarantee Act. And unfortunately, Representative Price responded with a no to that. So we're going to keep pushing. But this is just the beginning, and we're definitely going to get there.
Thank you so much for that report back. And I totally agree that we need champions in office. We need people that are willing to not just say that they believe healthcare is a right, but really do the work to make it happen. So my name is Stacey Barillo, and I live in Fuquay-Varina, which is the southern part of Wake County. And with our new congressional maps, I got a new district with this election. The Congressional District 2 was redrawn and includes most of Wake County except for the northern part of it. So we have our incumbent is not rerunning because I think George Holding felt like he was didn't have a good chance in this newly drawn district. So we have Democrat Deborah Ross and Republican Alan Swain running for our congressional seat, my congressional seat here. And so we have been busy trying to get their ears and delivering our petition messages to them as well as our potential candidates and potential representatives in Congress. So 3 of us went down to the Wake County Democratic Party office to try to find Deborah Ross or a staffer, and because she doesn't have a physical office. We didn't track her down there, but I did track down her staffer, Amelia, close to me in Fuquay-Varina. I hand delivered the signatures that we had collected from 1,000 voters and more than 24 North Carolina organizations. The staffer listened politely to my messaging. And then when I said we were really interested in having a meeting with Deborah Ross to further discuss this and our views and needs on health policy, I got just pretty much a no response. She's too busy. This was several weeks ago as well, that she's too busy with the election right now. And I'm sitting there thinking to myself, well, I think that, something that a candidate should be doing during an election is engaging with people, especially someone who shows up with a stack of signatures and listening to them on those issues. And hopefully moving forward, that the staffer did say that, after the election we'll talk, and we're definitely going to follow up on that and make our voices heard there. So I did follow up and ask if Ms. Ross had any response to the petition, and I did not receive a response to that yet. We did get a team of us got a chance to ask a virtual question or a question in a virtual meeting a few days ago, and our next speaker, Michael, is going to talk a little bit about that. One other campaign I wanted to share with you, like we're really brainstorming ideas, we're growing and finding new ways to engage with reps and pressure them. At the same time, we realize that just educating and urging reps to take action is not enough. And we're having discussions in our weekly meetings about direct actions, as well as other campaigns to bring more people into this movement. But so one strategy that we've used is sending out emails to our supporters in these districts. Like, so we segmented our supporters by District 2, and we asked them all to send this one-click email to Deborah Ross. We got it set up where she could, somebody could open our email and then click and send an email to Deborah Ross and Alan Swain, both candidates, because this is a nonpartisan issue. No matter who wins, we're going to keep in this fight, whether they're a Democrat or Republican. So we had probably around 15 or so people do that, go ahead and send the email. And there hasn't been a response to that. I noticed one of those people that engaged in that email campaign was a nurse, because she took my form letter and she edited it, which is what you should be doing. It's great to get those quick messages out there, but using your personal story, using your name, using your zip code will definitely amplify your voice with reps more. So she was writing about how she's been a nurse for 30 years and that how what we've heard from the other providers on this call, she's seen her patients suffer, that there's only one true solution, one comprehensive, one equitable solution, and that's Improved Medicare for All. So there are these contacts being made with reps like candidate Deborah Ross, and what we're seeing is that they're not being really responsive yet. They're saying, you know, healthcare is a right, but maybe their policies so much aren't lining up with their rhetoric, but we're going to be here holding their feet to the fire. We're not going away, and we're looking to grow our capacity. And we need you all listening here and all of our other supporters across the state to join us in these efforts. And before I pass it to the next person, I just wanted to speak directly to my two candidates for Congress, which is Cal Cunningham, who's running against Tom Tillis here in North Carolina for our open Senate seat, as well as Deborah Ross in the 2nd Congressional District. And again, what I was saying, you know, you say healthcare is a right. I hear you both say that, but we really need you to listen to your constituents. Your constituents want universal health care. If you look at the 2020 Democratic primary exit polls for North Carolina, it said that in our state this year, 55% of the Democratic voters support replacing private insurance with a universal health care program. So when we're seeing that sort of popular support, we should see our representatives and our candidates for Congress supporting this. We need our representatives in this fight with us. They need to stop listening to donors and industry and the holders of power in Washington and really fight for the people. Things like the public option, like others have said on this call, it's not going to fix the unaffordability issue. People are still going to be stuck with private insurance they can't afford to use, with medical debt once they're, once they fall sick or get injured. And the people that are going to be left out of such programs, it's going to disproportionately impact Black, Indigenous people, the Latinx community, low-wage workers, the undocumented. These are all of the people who are not going to be served by some patchwork system of the public option, the same way that they would be served by a cost-efficient switch to a universal single-payer healthcare program. And I'm going to pass it now to Michael Merenstein.
Thank you so much, Stacy. These, as you've heard from the other speakers today and other panelists, are challenging days for Medicare for All advocates. But that is absolutely nothing compared to what is being faced by millions of Americans who are losing their jobs and thus their health care coverage right in the middle of a pandemic. Or the challenges faced by those people with good insurance, the kind that members of Congress get. They're hit, like Joel Siegel was just hit with an $89,000 unexpected bill. I joined as part of a 3-person team along with pediatric nurse Megan Dunn and Stacy Borello, who we just heard We participated in a Facebook Live event, Cocktails with the Fabulous Four, included District 2 Representative Deborah Ross, Kathy Manning from District 6. In District 8, Congressional District 8, we heard from Patricia Timmons Goodson, for which I'm a constituent, and also from Cynthia Wallace, who we had spoken with as a team about Medicare for All just earlier in that week. They told us some of the things that constituents want to hear in an election year, like they support access to affordable care for everyone as a right, a willingness to expand Medicaid and protect coverage for people from pre-existing conditions. And they told us they were willing to listen more in the future. We did not, however, hear what we needed to hear. Not a single one came forward either to support Medicare for All or join in support for the Healthcare Emergency Guarantee Act, which would enroll all uninsureds in Medicare until the vaccine's available, cover all co-pays and out-of-pocket expenses for those that are insured. But we did make our presence felt. We made the case in the chat room, and even when only one of our questions was actually addressed. You know, although the push for universal health care goes back at least as far as Franklin Delano Roosevelt and Harry Truman, the Medicare for All bill was first introduced by the late John Conyers as head of the Congressional Black Political Caucus in 2003, and every year thereafter until he left in 2017. He believed, as do all of us, that it's not nearly good enough to save a few when we have the means to save everyone. All Americans deserve the same kind of health care security we insist upon for our parents, grandparents, elderly loved ones, and neighbors. What's more, we demand it for every stranger because we are indeed our brother's keeper. The protections that President Obama earned for those with pre-existing conditions and expansion of Medicaid was historic. It was life-saving. Ever the consensus builder and pragmatist, he achieved the first significant health reform in half a century. But Obama did not advocate for any specific legislation or involve himself too deeply in that process. Instead, he told congressional leaders he would sign and embrace whatever improvements were possible at the time, because the agenda was expanding healthcare as much as possible. The flawed nature of for-profit healthcare is built into its DNA. Everyone's money is gathered up in a single big pot from which the risk is shared and medical bills are paid out. Once a not-for-profit industry into the 70s, the primary legal duty of insurance companies is to its shareholders. The less money paid out, the more insurers get to keep. At the bottom of it all, profit motive demands rationing care and limiting what is paid out. They are the only winners in our current system. While insurers continue to make record profits, literally everyone else in America suffers. American businesses are paying out $17,000 per year for each full-time employee for medical care. Over 65% of personal bankruptcies in the US, even after the ACA, are still caused by medical debt and medical bills. Americans with those with coverage continue to self-ration their care in order to avoid the costs of deductibles and copays. Meanwhile, cancer grows, heart disease worsens, diabetes goes undetected, and the virus spreads. As we speak, there are mothers and fathers, husbands and wives invisibly pleading with their insurance companies to cover a beneficial medication or paid for needed treatment. These are who we are speaking on behalf of. Patients are misdirected through a maze of providers, slowing treatment and discouraging it altogether. More insurance company wins. Studies, including even those of the Koch brothers, shows that Medicare for All will cost taxpayers less than all other approaches, including our current system or the public option. It will cost legitimate businesses employers less and encourage expansion and hiring of more full-time employees. It will cost American families less. Medicare for All also provides Americans with a true and meaningful choice. They will not merely have the right to choose which offered insurance plan they can afford or whether they can afford to visit the doctor after copays and deductibles. Instead, they can go to any healthcare provider in the nation they choose, get all the care they need, and be secure in the knowledge that the bill has already been squared. Not only is Medicare for All the best policy, as Italo is explaining, it is also the best politics. Improved Medicare for All is wildly popular among Democratic likely voters, supported by a majority of independents and even a significant percentage of Republicans. In short, it is exactly what one would want to find as a winning political issue. Meanwhile, our politicians continue to seek political cover by supporting only Medicaid expansion and the public options, and they are still being attacked as radical leftists. Their opponents, it seems, cannot be politically appeased by offering lesser policy options. Unwinnable voters remain unwinnable voters. Making this present situation all the more intolerable is not that there isn't a clear or easy fix. It is that there is such a solution, and our leaders of all ilks refuse to champion it. Today, America is the exception among nations in seeking to control a virus that has already killed nearly 250,000 people. It is also the exception in failing to care for all of its people by providing them the care they need as a matter of right. It is called Improved Medicare for All. There are no adequate substitutes any more than a mother can choose which child she would pick to live over another. It is long since time for America to join the civilized nations of the world and care for all its people, black, white, brown, yellow, young, old, rich, poor, male or female, simply because we have the means to do so. And heck, it even costs us less to do so.
Thank you so much, Michael, for that passionate speech. You made so many good points, as did everyone here. We're going to wrap up here. There's a few things I would like to say before we end this live video and move forward with our work for Improved Medicare for All. These links here are ways that you can connect and get to work. That top link, that bit.ly/M4A toolkit, which is case sensitive, that will bring you to a toolkit with sample tweets, contact information, including the Twitter handles of the entire North Carolina congressional delegation, as well as the candidates. And then that link at the bottom, the ncm4a.org/campaign, will bring you to our website, and you'll be able to read that petition, the Healthcare Emergency Guarantee Act petition that we've been talking about today. They're on that website, and sign on to it as well. Signing on to it will also connect you to our communications, meaning that you will get weekly emails from us, keeping you updated on the work that we're doing. I did want to let you know that we do have partners within the coalition, which again is made up of around 30 groups in North Carolina. I believe it's the Southern Workers Assembly and National Nurses United who are the main partners who are working on lobbying G.K. Butterfield, which is the Democratic congressional rep in the 1st Congressional District in North Carolina. He is the only Democrat in North Carolina who isn't already a co-sponsor of Medicare for All. So if you are a constituent of his, please reach out to him and let him know your thoughts on expanding healthcare to everyone. And we just invite you really to join us. Everyone listening to this live or listening to it later on, help us build the capacity to reach every single elected official, every single member of North Carolina's congressional delegation, and reach them regularly with their constituents. We need your help, so please visit our website and join us. The last thing I wanted to say is just a teaser for our next event that we have coming up that I would like to invite you all here to join us. And this event is still being planned, so some of this information is tentative, but we want to bring people together into community safely, masked and socially distant outside, for an event we're thinking of holding it on International Human Rights Day, because healthcare is a human right, and that day is December 10th. And we're thinking of holding it in multiple locations across the state. And thinking of having an actual bonfire in places that would accommodate that, which would be, of course, someone's private property or maybe a public campsite where that is allowed. And have people come together with their insurance bills, with their medical debt, and have some cathartic community and lighting those on fire and joining together and renewing our commitment to fight for Medicare for all in the new year, and hopefully in a new administration. So I just want to thank you all for joining, all of our panelists, and also everyone who joined and watched. And does anyone have any other closing thoughts they want to say besides get out and vote? Everybody in and nobody out. Thank you so much. We're going to end the call now. Take care, and we hope to see you soon. NCM4A.org. Bye-bye.